Hello again, and good morning, everyone. Thank you so much for joining today's Using PSYCKES and the VSD Vital Signs Dashboard for Health Disparities. My name is Michelle Hand. I'm a research scientist on the PSYCKES, or the Office of Population Health and Evaluation Medical Informatics team, and I'll be leading today's webinar. And I'm also joined by my colleague Katie to help assist in answering any of your questions today. So we'll go ahead and get started and look at the agenda for today's training. First, we'll do a PSYCKES overview, which might be review for some of you, talking about what PSYCKES is, who's included in the application, what type of data is available. And then we'll go over recipient search. So we'll look at certain health disparity filters we have in recipient search to complete those group cohort searches of interest. We'll also review client-level details within the clinical summary and show where to locate some disparity-related information there. We'll touch on My QI report, which is where we'll show the health disparity-related quality indicators that we have, and also we'll show the race and ethnicity view we have in My QI report as well. We'll look at statewide reports, and then we'll touch on the Vital Signs Dashboard, the VSD. And then finally, I'll stop for training and technical assistance and answering any final questions. So we'll go into the PSYCKES overview. And what is PSYCKES? So PSYCKES is a secure, HIPAA-compliant, web-based application that's used for sharing Medicaid claims and other state administrative data. And what it does is it puts this information into a user-friendly format to help really support that clinical decision-making, care coordination, and quality improvement for some of the quality improvement projects your agencies might be enrolled in. And we have ongoing data updates in PSYCKES, so we have the clinical summary, that client-level view, and that's updated on a weekly basis. And then we also have our quality indicator reports, and those are updated on a monthly basis. So who's included in PSYCKES? Right now we have over 11 million New York State and Medicaid enrollees, either currently or previously enrolled. And this includes fee-for-service and managed care encounter data, and also includes dual eligible information. So that means Medicare and Medicaid. But in PSYCKES right now, we have Medicaid data only at this time. So if somebody has, for example, medications that are being paid for by Medicare, those would not show in the application, only Medicaid data at this time. Now, once somebody's in the Medicaid population, they also have to be within the behavioral health population to be included in the application. So that means they need to have at least one of the following billed to Medicaid: a psychiatric or substance use service, a psychiatric or substance use diagnosis, or a psychotropic medication billed to Medicaid. But once somebody's in PSYCKES, the information you'll see for them would be across the treatment spectrum. So that includes information on medical and behavioral health, residential, lab and pathology, housing, etc. So here is our list of data sources that we have feeding into PSYCKES. So the clinical summary, that client-level detail, provides up to 5 years' worth of data. And just to reiterate, again, this is updated on a weekly basis. And we have two sources of data coming into PSYCKES. We have Medicaid billing data across the treatment spectrum. So this includes Medicaid information on medications, medical and behavioral health, outpatient and inpatient services, ER information, health home care coordination, housing and residential, lab and pathology, dental and vision, etc. Now those claims coming from Medicaid billing data have a bit of a lag to them, can take upwards of a couple of months to show in the application. So we also have state administrative databases feeding into PSYCKES as well, and those have a shorter lag time. The lag time is 0 to 7 days for these state administrative databases. And we have a list of them showing on the screen right now. The first is a newer data source that we've acquired, and that would be the New York City Department of Homeless Services, NYCDHS data. So this would show information on the shelter name, the program type and placement date, the exit date, exit reason, and that shelter director contact information. We also have information coming from DOH MAP, so that would be the health home enrollment and care management provider information, along with that health home contact information. And then we have managed care plan and HARP status coming from the managed care enrollment table. We have the managed care plan assigned primary care physician. That's coming to us quarterly from the Department of Health. And then we have TACT sending us assisted outpatient treatment information. We have CARES sending us ACT, assertive community treatment contact information, and adult housing and residential program information. We have DOH-MH sending us intensive mobile treatment and AOT referral under investigation data. We also have state PC EMR information. So if a client spends some time at a state PC EMR or a state PC center and they don't bill Medicaid directly, we'd still get access to that data because we have the state PC EMR as one of our data sources. And then the last couple of data sources we have, the last is NIMERS, and that shows suicide attempt information. And this is not restricted to that 5-year look-back rule. Suicide attempt information is considered all available data, meaning if an attempt occurred 10 years ago, that would still show up in the application. Now we have what we call quality indicators or flags in the PSYCKES application. And what these are OMH-identified health conditions or treatment issues that are important enough that they're worth scrutinizing. So what PSYCKES does is it tracks clients who are positive for one or more of these health conditions or treatment issues. In this way, that the provider or the managed care plan or the state government leadership can be made aware and take the necessary next steps. And these flags also help with supporting clinical review and quality improvement. Now we have a number of different indicators that are broken down into indicator sets or buckets. And for today's training, we've detailed a couple of quality flags that might be related to health disparities in the work that you do. So our first example is the Vital Signs Dashboard Child Indicator Set. And a couple of examples of these quality indicators would be no well-care visit past year, or immunization for adolescents, no HPV or meningococcal. And then we have Vital Signs Dashboard for adults. This indicator set would look at no follow-up after mental health inpatient, 7 or 30 days. Then we have our medication-related flags, and an example of one of these would be no follow-up for child on an ADHD medication. We also have hospital-related flags. So our high utilization indicator set looks at folks who have had multiple hospitalizations within the past 13 months. And then our readmission flags look at clients that might be cycling in and out of hospitals. And then our general medical set, an example of an indicator here would be if somebody didn't have an outpatient medical visit in the past year. So these are just some examples of our flags. I believe right now we have over 80 quality indicators in our application. But if you ever have a question about why somebody is showing positive for a quality indicator, you can always go onto our website and our quality indicators page and look up the technical specifications. But if you have any further questions, you can definitely email our help desk, and I'll make sure to provide that contact information at the end of the webinar. We have a number of different reports available, and I went over a couple of these in our agenda for today. But again, that client-level clinical summary is one of our biggest, most popular reports that we have, and that includes up to 5 years' worth of Medicaid and state PC treatment history for a client. And we also have provider agency level reports. So we'll look at recipient search today, and this is where you can run those ad hoc reports for cohorts of interest. And we'll look at some of those health disparity filters that we have. We also have MyQI report. We'll be looking at that as well, and that looks at the current performance on all quality indicators by using a prevalence rate. And from there, you can also drill down to the client-level clinical summary. We have the usage reports, and this is really used to monitor protected health information accessed by staff. So looking at what clinical summaries are being accessed, what level of access they have, who's logging in, et cetera. And then we have our utilization reports, and these were really built to support value-based payment data needs. And then lastly, we have our statewide reports. We'll look at that today, and that's where you can select quality indicator and review the statewide proportions by prevalence rate, by region, county, plan, network, or provider. So we'll go into recipient search first. So in recipient search, you can do two things. You can look up an individual client by using one of their unique identifiers, which would be their Medicaid ID, their Social Security number, or their name and date of birth. And then below the individual search section, we have a group search section, which includes a bunch of different filters. So an example that we have for disparity-related filters would be searching using the race or ethnicity filter. We also have a county or region filter, a newer social determinants of health domain or condition filter box, which I'll show today. We have homelessness alerts filters. So you can look up clients that have experienced homelessness in the past year, if they're sheltered or unsheltered, or in outreach. And then we have high utilizers or high cost individual search functions as well. And I made a note here that we have advanced views. So this can really help to focus your search results. And what these advanced views do is on your search results page, you can add on one of these advanced views, and I'll add on specific columns to your search results page. So you can really look at a bulk population management view. So this is what recipient search looks like. So on the top purple navigation bar, we've selected recipient search. And you can see at the top in the recipient identifier section, this is where you perform your individual search if you're looking for one client. And then everything below that is the group search. So you can really slice and dice your report here and add on different filters of interest to look for that cohort you're interested in. So we're going to go look at the social determinants of health section first. So this section includes societal and environmental conditions that can impact a wide range of health risks and outcomes. And right now, this section solely uses Z codes from Medicaid billing as a data source. We're working to get access to CMART data as well, but right now the section is just from Medicaid billing. And when you run a search here, you can see that you can select this little plus sign in the domain, and that'll show all of the social determinant of health conditions within that domain. And you can select up to 4 different filters here at one time. So I'll show what that looks like. If you open up one of the domains, you can see here we've selected 3 different social determinant of health conditions. We've selected transportation insecurity, extreme poverty, and lack of adequate food. And you can see on the right-hand side the ones that you've chosen. And then the next section we'll look at today is the race or ethnicity filters. So here you can see in the characteristics section, we have the race filter, and here we have actually a checkbox function in the application where you can select up to 4 different races for the population search you want to complete. So here we've selected Asian or Black or multiracial, and it uses the OR logic because it's selecting filters from that same filter box. So in conjunction with the race filter, you can also use the ethnicity filter. And here you can select Hispanic or Latinx, not Hispanic or Latinx, or unknown ethnicity. And these filters can be used in conjunction together. And if you use the race filter and the ethnicity filter, it'll create an AND logic since you're selecting from 2 different drop-downs. I also want to mention that these filter boxes are being pulled from Medicaid data at this time. All right, we'll switch over to the region filter that we have, and this is based on the county of fiscal responsibility, which refers to where clients are registered to receive Medicaid funds from. So there should be no duplication here. A client should never be included in 2 region buckets. So if you select a specific region, we have Central New York, Hudson River, Long Island, New York City, and Western New York. If you select one of these regions, go to the next screen, you can see the county filter drop-down will show based on which region you've selected. It'll show the counties included in that region. So you can use these filter options in conjunction with each other as well. All right, and now within the special populations box, this is a newer labeled section in recipient search. Within the high need population filter dropdown, we have high Medicaid inpatient ER cost filters. And we have them for the top 1% and the top 5%. So these identify behavioral health Medicaid enrollees who represent the highest cost statewide for any inpatient or ER services. And these are linked to the organization under which you log in as, so this will bring up clients that you're serving that are identified as the highest cost statewide. Now this filter is updated on a monthly basis, and it includes costs associated with inpatient or ER services for any cause, including medical, psychiatric, or substance use services. And this is again based on Medicaid billing claims and encounter data. And then we have the homelessness alerts filter. We're still in that special population section. And if you look down, we have the homeless alerts filter. And here it has the same logic as the race filter dropdown. You can select up to 4 different homelessness options here for your search logic, and that will use that OR criteria. So you can search for somebody who's had shelter according to DHS or outreach according to DHS, behavioral health shelter past year DHS, or they've been unsheltered past 1 year according to Medicaid. And again, if you search using the DHS information, this will include that shelter name, the program type, placement date, exit date and exit reason, and then the shelter director contact information that would be included in the client's clinical summary. And next, we're going to look at the quality flag box on recipient search. So we have a few different disparity-related quality flags here, and these are really referencing the vital signs dashboard adult and child indicator sets. And I want to just mention here we have a high mental health need flag. So that really looks at anyone in PSYCKES who meets one or more of the following criteria. So that looks for people who are AOT active or expired in the past 5 years, ACT enrolled or discharged in the past 5 years, intensive mobile treatment in the past 5 years, if they've had one or more inpatient mental health in the past year, one or more ER inpatient visit in the past year for a suicide attempt, ideation, or self-harm, or if there was 3 or more inpatient medical visits in the past year, and they also have schizophrenia or bipolar. So that's just the high mental health need flag criteria, which we can always send, if you email us at PSYCKES Help with that question, we can always send you the criteria so you have it. But these were just some of the highlighted disparity-related flags we have, and here you can select up to 4 different quality flags per search. And if you ever have a question on what a flag is looking at, we also have this definitions button on the top right. And if you click on that, you can export the PDF to a PDF for the quality flag definitions. So here's an example search I've completed. So I used that race search filter, and I looked for Asian or Black or white. And then you can see I've also added on a homelessness alert, and I looked for people who have had any homelessness alert in the past year according to DHS or Medicaid. I also added on an ethnicity filter, so they're Hispanic or Latinx, and then I'm logged in as Main Street Clinic, and I even added on a social determinant of health condition, problems related to housing and economic circumstances. So this is definitely a few different filters I've used here to really slice and dice my report for that cohort I'm really interested in looking at. So on the results page, you can see we have a rather large agency, so 790 recipients were found that matched this criteria. And you can see the client's name, their Medicaid ID, their date of birth and gender, any quality flags that they currently meet criteria for, their Medicaid managed care plan, and since I'm logged in as an agency, I can see the current PHI access, whether I have consent, quality flag, clinical emergency access, or no access. And in the top right, you can see that we have the Advanced View drop-down. So here I can click on this little drop-down arrow and I can select from the Care Coordination Advanced View, which would add on filters related to care coordination, such as health home enrolled, CMA enrolled, etc. We have a High Need, High Risk Advanced View, a Hospital Utilization Advanced View, and then an Outpatient Providers Advanced View. So a few different ones to choose from. I'm not going to go into what that looks like today. We have another webinar called Navigating PSYCKES Recipient Search for Population Health, which really dives into all of the different filters you can find on the recipient search page and also what that advanced view looks like. So I would highly recommend attending that webinar if you want to learn a little bit more about the filters you can use on the recipient search page. So I'm going to stop here and see if there were any questions before I go into the client level clinical summary.
Thanks, Michelle. There are no questions at this time.
Okay, great. Thank you, Katie. All right, we'll move right along to the clinical summary, which is that client level view. So the clinical summary, it summarizes up to 5 years worth of treatment history and data for a client and puts it really into a user-friendly format. Now, it takes all of this data and integrates it. And for example, some of the information you can find in the clinical summary is homelessness information, social determinants of health. We have the high mental health need reason if somebody is positive for the high mental health need flag. Earlier I mentioned all of the criteria that somebody could have for this flag. So if they do have that flag, you would see the reason as to why in the clinical summary. We can also see if they have any active quality flags, care coordination information. We have a graph called the Integrated View of Services over time, which looks at treatment patterns. We have their AOT status, any hospitalizations, or suicide information as well. That can all be found within the clinical summary and more. And then you can see episodes of care linked to detailed dates of service if you need to, and that includes diagnoses and procedures. And it's really organized by sections, just like an EMR that you might be using at your agency. So there are a few different viewing options we have for the clinical summary. Automatically, you're going to land on the brief overview screen, which is a snapshot of the most critical information, so you can help easily identify that if you need to. We also have a one-year summary, which gives a bit more information than the brief overview. And then the 5-year clinical summary is that full of all available data information for that individual. So I'll show what this looks like. When you drill into a client's clinical summary, if you have access, you'll land on the brief overview screen. So you can see the client's name, the clinical summary as of date. This is a little bit outdated, but this again is updated on a weekly basis. We have the brief overview view that we're currently on. And you can see we have an About Included Data Sources hyperlink, and I'll show what that looks like. That's going to list out all of the available data sources for the clinical summary. You can also export to PDF the brief overview, and then you can see the client's general information and the current care information. So for this client, we have homelessness information from the New York City Department of Homeless Services. We also have the high mental health need reason right down towards the bottom, and you can see that they're positive for this flag for this reason listed here. And then you can also see that they're eligible for core services. So the current care information is really going to have the most up-to-date information since it's updated on a weekly basis, and it also has some who do you call information, or so we call it, since there are some emails and numbers for people to contact for these services. So I'm going to show what the About Included Data Sources looks like. So if you click on that link at the top left on the brief overview, this pop-up will appear, and this will really show where all of this information is coming from, and it's broken out by each data source. So just if you want to reference this in the future, you can export it to PDF and use it for future reference. So if we scroll down the brief overview, there's quite a bit of information you can find. We have the alerts section, the social determinants of health section, any active quality flags that the client might have, any diagnoses in the past year. And if you keep scrolling, you can also see their medications in the past year, outpatient providers, and all hospital and crisis utilization. Now this section is showing in the past 5 years since it's such critical information. So I'm going to go into the one-year clinical summary view, but first I just want to mention what you can find in the current care section and the alerts section. So as we saw, that person had homelessness information. You can also see if they're enrolled or in outreach for a health home or care management agency, if they're eligible for Health Home Plus services, again, the high mental health need reason, and also if there's a Medicaid eligibility alert, which is an alert for Medicaid recertification. There's a lot more information you can find in the current care section, but those are just some examples of data that's there. And then we also have the alert section, so you can see suicide ideation and attempts, self-inflicted harm, opioid overdose information, homelessness, and OMH unsuccessful discharge data. And that's coming from NYMERS and Medicaid billing. So we're going to switch over to the one-year clinical summary. And here you can see that there's a bit more information showing. So that homelessness service data is coming from DHS. And here you can see that this information, where it's coming from DHS. You can see the health home information is coming from MAP. So it just gives a little bit more information on the 1 and 5 year views. You can also see, for example, not for this client specifically, but you could see if somebody's enrolled in OnTrack, if somebody's eligible for OPWDD New York START, if they have AOT or ACT. There's a lot of different things that can be included in this section, but those are just some examples. And here's the alerts and incidents section in the one-year clinical summary view. So here you can see that you have the alert type showing in the left-hand column. Then you have the number of events, meds, or positive screens, the first and most recent dates, the provider name, the program name, and the severity, diagnosis, meds, or results. And you can also drill into the See Details button to see some more information there. So that is the alert section, and I'm going to go into the social determinants of health section next. So here's what this section looks like in the one-year view, and it also looks the same in the 5-year view. So it's a little bit different from the brief overview because you can drill in to see more information on the SDOH that this person was billed for. So this person, you can see, had unemployment, insufficient social insurance and welfare support, financial insecurity, inadequate housing, and food insecurity. So you can click on any one of these social determinants of health to view more details. And below, this is what the pop-up looks like. So you can see the date of service for that SDOH, the service type and service subtype, the provider name that billed for the SDOH, and then any primary, secondary, and quality flag related diagnoses that went along with it. And then we have the quality flags information, and here it'll show what active quality flags the client has. Again, you can see that they have high mental health need, which is due to 1 inpatient mental health stay in the past 12 months. We also have our disparity-related quality flags showing. So here's the Vital Signs Dashboard adult indicator set, and you can see that they're positive for the low antipsychotic medication adherence, schizophrenia, and no follow-up after mental health inpatient 7 days quality flags. Again, you can click on this definitions button, which will show you the definitions for each of these flags. Or you could switch your view for this section to a table view or a graph view just to help see the patterns of these quality flags for that individual. So again, this was a brief overview of the clinical summary related to disparity information. We have a Using the PSYCKES Clinical Summary webinar, which goes way more in depth into each section of the clinical summary. So I highly recommend that as well if you're interested in learning more about this section of the PSYCKES application. So next we're going to go into My QI Report. And what I want to do is just explain a little bit about what My QI Report is first before we go into it. So it's really a tool for managing quality improvement efforts. And again, this section of PSYCKES is updated on a monthly basis. So we have the eligible population, which is also known as the denominator, and this looks at the number of clients served by your organization in the past 9 months, plus any other parameters depending on that quality indicator specifications. So again, this is just an important note I want to make. Each quality indicator has their own technical specifications. So it's really important to refer to those when you're looking at who's included in this quality flag. Now the numerator, that would be the people that are meeting criteria for that flag. And then we take the numerator over the denominator and we create a prevalence rate. So here you can compare your agency's prevalence rate to the region and the statewide prevalence rates. In My QI Report, you can also filter by program type, by managed care plan, age. You can also filter by region or county. And then you can drill down into a list of recipients that meet criteria for the flag you're looking at. And then lastly, as with all of our reports in PSYCKES, this can be exported to Excel or PDF. So just to confirm that we're understanding My QI Report, it's a little bit different from how people are linked compared to recipient search. So I just want to make sure folks are understanding how people are attributed to your agency's My QI Report. So this is through billing so that the clients are linked to your provider agency if you've billed for them within the past 9 months. And this is a rule used to automatically link clients to providers so that current clients are included in each month's report. Now that's how clients are linked if you've billed for them within the past 9 months. The period of observation for the quality indicator, that differs by measure. So for example, the period of observation for our high utilization hospital measures is looking at the past 13 months, whereas the period of observation for other indicators might be the past 12 months. And it's really important to look at our current as of date. So right now we're as of August 1st, 2023, so you'd be looking back the past 13 months from the as of date for the high utilization indicator set. And then we also have QI trends past year. So that's a way to look at the prevalence rates of quality flags by provider over time to look at any quality indicator patterns. So we'll go into My QI Report now. And as of recently, this screen has been divided into 2 different sections to help easily identify between the measures. So we have our quality improvement indicators, and this indicator set is considered more real time and is run on a monthly basis as of the refresh date. And you can see the refresh date up here. This is slightly outdated, but right now it's as of August 1st, 2023. And then this other highlighted section, performance tracking indicators. These indicator sets contain more mature data, and they're calculated monthly after a 6-month data maturation period, which allows for services to be invoiced. So those are the differences between the 2 sections highlighted. Now you can click on this Filters button on the top right, and you'll see a Filters pop-up box show. And here you can filter by program type, by managed care plan. An example of program type might be looking at clients that are enrolled in your health home or CMA, or maybe enrolled in your mental health clinic. By managed care plan you can filter. You can also filter by product line, age, or in this case, region and county. And this region and county filter is based on billing. So if we keep going in My QI Report, we can drill into one of our health disparity related quality indicators. So you can see at the bottom we have Vital Signs Dashboard Adult and Vital Signs Dashboard Child. And again, I just wanted to mention the columns quickly here. We have our indicator set name, the population, so who could be included in that indicator set. The eligible population looks at who can be included in that specific indicator that you've served in the past 9 months. That's our denominator. And then we're looking at the number with QI flags, so who's positively flagged for any of those indicators. So you take the numerator over the denominator and you're given your agency's prevalence rate. And you can compare that prevalence rate to the region's prevalence rate and the statewide prevalence rate. And we have a little helpful bar graph over here that you can see as well. Now, the higher the prevalence rate, the more opportunity for improvement, so you'd want to see your prevalence rate go down over time. Okay, so we'll drill into the vital signs dashboard adult indicator set. And you can see now all of the quality indicators that live within that set. So there's quite a few of them. But in this example, we're going to drill into the no follow-up after mental health inpatient 7 days. So again, since I'm logged in as Main Street Clinic, I can see what population's included in this indicator set. What's the eligible population? How many people I'm serving that are flagged for this indicator? And then I can see my agency's prevalence rate. So if you drill into that specific quality indicator, you'll be brought to the Recipients tab here, which shows all of the folks that you're serving in the past 9 months that are positive for this quality indicator currently. So you can see the recipient name, their Medicaid ID, their date of birth. You can view the race and ethnicity coming from Medicaid billing. You can view any quality flags that they are positive for. The most recent behavioral health outpatient attending, if they have one, and then the date the clinical summary was last viewed. So here you could drill into a client's clinical summary. You could also export to PDF or Excel, or you could change to the race and ethnicity view that we have in my QI report. So I'm going to change to the race and ethnicity view, and you do that by going to this view drop-down. I'll show what that looks like. And see, we've switched to the race and ethnicity view here. So you can see that this view has completely changed. Now there's more columns added. So this view displays the percentage and number of clients flagged for each of the quality indicators, but it's just broken out by different race and ethnicity groups. And again, Medicaid here is the data source for the race and ethnicity information. And this view is applied to both the numerator and the denominator of each indicator to calculate that percentage you're seeing. So when this view is applied, we have clients who identified more than one race in their Medicaid registration. They are represented in that multiracial group. We also have clients who identified Hispanic or Latinx as their ethnicity, and they're represented in the Hispanic or Latinx group only, not in multiple groups. And then clients for which race is unknown are included, they're included in the total, but they're not represented in a separate race or ethnicity group here. So you can see the different race and ethnicities by percentage or by this helpful bar graph on the right-hand side. And I'm going to go to the next slide, and this will show what it looks like just if you hover over one of these bar graphs, you can see the numerator and the denominator, which provides that prevalence rate. So if you ever wanted to go to this view and export to Excel, you'd be able to see the numerator, denominator, and the percentage for each of these groups as well. All right, I know that was a lot of information, so I wanted to take a quick pause here and check in with Katie if any questions came in.
No questions at this time, Michelle.
All right, thanks, Katie. Okay, so we'll go on into statewide reports. All right, so here's what our statewide reports, the first screen will look like. You'll go to statewide reports in the purple navigation bar at the top, and then you'll be prompted to select an indicator set and then an indicator type. So in this example, I've selected Vital Signs Dashboard Adult, one of our disparity-related indicator sets, and then I chose Vital Signs Dashboard Adult Summary. So the summary measure is looking for clients that are flagged for any one of these indicators included in this indicator set. So you can also add on region or county filters, managed care plan or product line, the program type filter, or even an age group. And again, at the bottom, if you're ever wondering what a specific indicator means, you can go to our indicator definitions hyperlink, and that'll show a pop-up of all of the definitions. So if you select an indicator and click search, you can then see the statewide reports. So here you can hover your mouse over a county on the map, and you'll see more details displayed. So this report also provides information in the table below. So you have this visual representation and then the table representation. And here you can switch throughout the tabs we have. We have region tabs, county, network, provider, and plan. And for each tab, you'll see the state data will appear in the first row, just like this example here, and then followed by the data pertaining to that tab below the state information. So this is where you can really compare how provider agencies are doing in regards to a certain quality measure, and you can compare to that statewide prevalence rate as well. And it's all aggregate data, so any user can view this information. And what you can do is you can go back and apply more filters, or you can export to PDF or Excel as well. So that was a brief overview of the statewide reports, and now I'm going to talk briefly about the Vital Signs Dashboard. So the Vital Signs Dashboard is a tool used to visualize public mental health system performance within domains of access, quality, and treatment outcomes. And it's derived from Medicaid claims and refreshed on a monthly basis. And right now, the VSD is showing from July 2021 to June 2022. In this application includes the full Medicaid mental health population, and that's individuals who received a mental health diagnosis or service in any setting. Now, we have data in the VSD available by county, region, provider agency, or network. And then you can also filter by population, and that you could look at the full mental health population, OMH licensed programs, or by program type. And then we have the disparity population, so that includes race, ethnicity, gender, or region. So the VSD is important because it really helps to identify emerging and persistent disparities, and it also helps provide input to OMH's quality strategy to improve the public mental health system. So you can see the more we collect data on workforce diversity inclusion, training, mentoring, and supervision, that can all be affected by the VSD and help reduce disparities. We have a number of different quality measures showing in the VSD. So these measures are tools that help measure outcomes that are associated with the ability to provide high quality health care. So right now we have 12 adult and 11 child and adolescent measures currently in the VSD. And the VSD measures selection was through relevancy, so measures that highlight disparities. We also looked at importance, so measures currently used in public mental health systems by managed care plans, by VBP or by BHCCs, etc. We looked at feasibility, so how we could establish measure definitions familiar to the public mental health system. And then we also used CMS and New York State QAR. They prioritized measures for stratification by race. And of course, these measures that were selected originally can definitely evolve over time. But these are the measures that we have so far. So you can see we have different domains, and you can see what measures are included in each domain. So here's the first slide on that, and here's the second one. We have a number of different measures for both adult and child. So the VSD was released to mental health providers in August of 2022, and it's accessed through this web link you see on your screen here. And I'll be sending out these slides for all attendees to use this afterwards. And this link works best on Chrome, Edge, or Safari. And then this was publicly released last month in August of 2023. So I'll show what the VSD looks like. If you use that link and click on it, you'll see there's 4 tabs at the top: VSD Home Adult, VSD Child, and Data Download and Definitions. So here you can select from the region, county, network, or agency at the top right here. And then you can also opt to select the population. So right now it's on the full mental health population, but you can also search by OMH licensed programs or by OMH licensed program types. And then you can see this report is divided into categories. So we have the access domain and the measures included there, the treatment outcome domain, and then the quality domain. So if you hover over one of these percentages, you can see more information. So you can see the domain, the measure name, and the measure description, the age specification for that measure, the denominator and numerator, and then the data collection time frame as well. So that's if you hover over those percentages. Now, if you scroll down that page, you can also view the measures by disparity populations, such as the total mental health population, the race ethnicity population, which is currently showing, gender, or by recipient region. Now you can view this as a chart or a table. That's another filter option at the top. And here you can see on the left-hand side the measure name, the population include that we're looking at, the statewide average performance, the disparity category, the numerator and denominator, and the performance. And then you can see it compared to the statewide average, if it's lower, equal to, or higher than the statewide average. And then if you hover over one of those dots showing, you can see the numerator and denominator for that specific disparity category you've selected. And then if you view this as a chart, we are just looking at the table, but if you switch your selection over to a chart view, here you can see visually the region, county, or agency's performance compared to the statewide performance rate per measure. So either lower than the statewide, equal to, or higher than. And you can, of course, hover over those color options as well to view more information. So I'm going to go over some training and technical assistance and then make sure to stop at the end in case any questions came in. But we have a few more training webinars on our website, including the ones I've mentioned today. So if you go to our website, PSYCKES.org, you can either register for an upcoming live webinar or view our slides or recordings for past webinars. So we have an Introduction to PSYCKES webinar, which gives an overview of all different screens in the application. We have a Where to Start webinar, how to get access to PSYCKES. And then our Quality Indicator Reports webinar really dives a bit deeper into each of the tabs you can find in the My QI Report screen. We didn't go over all of the tabs today, but it definitely delves deeper into the information that can be found in that report. And then we have the Recipient Search webinar, the Clinical Summary webinar, both of which I've mentioned. We have the Consent Emergency Quality Flag, PSYCKES Levels of Access webinar, which explains how you can access client-level detail in the application. And then we have a mobile app webinar. So here you can see how our mobile app works, how to log in, what information's in there, how to complete a safety plan or CSSRS. And that's a really helpful webinar with a live demo included. And then we have our short how-to videos if you need help logging in, or if you're receiving an authentication error, or if you want to watch a quick video on how to look up a client. We have quick 5-minute videos posted to our PSYCKES training materials page. Now, here's all of the help desk support information. We have PSYCKES help. We're available 9 to 5 Monday through Friday at psyches-help@omh.ny.gov. And we're more than happy to help with any report questions you have, any quality flag questions. We're definitely available to help with that. And if you have a question on a specific client, you can send us that client's Medicaid ID in a protected way. So either by sending it in an Excel file that's password protected, or however your agency sends PHI in that protected way. We'd be able to look into that person for you. We also have a data OFI help desk for any VSD support. So I gave a brief overview of the VSD today, but if you have any questions while clicking through there, you can email the data OFI@omh.ny.gov email address you see on your screen. And then for any token, login, or SMS support, we have our OMH employee help desk at fixit@its.ny.gov. Or if you're a non-OMH employee, we have health@its.ny.gov for any problems logging into the application. And with that, I'm going to take a final pause here to see if any questions came in.
There are no questions, Michelle.
Okay. Well, thank you so much, everyone, for joining, and I will give you 9 minutes of your day back. I appreciate your time, and have a great rest of your day.